Welcome everyone. We're very happy to be at this webinar with as topic staying well with hemophilia during this COVID-19 pandemic. My name is Roussel. I work as physiotherapist and as associate professor at the University of Antwerp, and my research domain is chronic joint pain. And I'm very, very happy to be here together with my colleague Sébastien Lobet, who is an international renowned expert in hemophilia.
Hello, I'm Sébastien Lobet, physiotherapist specialized in hemophilia, but also researcher. I'm working at the Clinique Universitaire Saint-Luc in Brussels, Belgium, and I'm collaborating for years with my colleague, Professor Nathalie Roussel, on several topics, including chronic pain in patients with hemophilia.
Okay, these are the disclosures of Dr. Sébastien Lobet. These are my disclosures. And this is what we would like to discuss today. So we are facing a changing world, and this COVID-19 pandemic forces us to rethink our lifestyle. And this is the purpose of this webinar. It's to give you some ideas about how to change your lifestyle in order to be active even in this COVID restriction period. So we will discuss exercise. Why is it important to be physically active? And also, how can we do that during these COVID-19 restrictions? But we will also say a few words about pain, because pain seems a contraindication to move, but it's not. Actually, physical activity is even indicated in patients with chronic joint problems and is used as part of a pain management plan. And we will end the presentation with a few key take-home messages. So, first of all, a changing world. The COVID-19 pandemic forces us to stay at home, to avoid seeing people, to avoid being physically active, and we have to face with this situation maybe for some time.
As you know, we are now talking about the COVID-19 pandemic. But do you know that physical inactivity, in fact, was defined as a pandemic in 2012 by the World Health Organization? So insufficient physical activity trend to persist because during the quarantine, it implies radical change in the lifestyles, and many opportunities to be physically active have been suspended. We are not going anymore to the fitness. Our kids are not participating in school-based physical education. Some patients are not participating into outpatient cardiac rehabilitation. So, as you can see, many of our physical activity have been suspended during the COVID period. And you may know that you can be more at risk of COVID-19 if you have this some pre-existing conditions, such as, for example, high blood pressure, or if you have diabetes. If you have diabetes, you have two times more risk of hospitalization and mortality with COVID-19. If you have heart disease, if you have chronic respiratory disease, for example, you increase by 6 times the chance to be hospitalized for a COVID-19. And as all these conditions, in fact, are chronic diseases, and all these conditions can be improved by physical activity. That's why doing regular physical activity and sports is so important during this period of pandemic. As you can see on the next slide, the dose of physical activity is also important, because the more you will do physical activity, the more chance you have to reduce some chronic diseases. As you can see, if you are, for example, 5 or 6 times more active as compared to the normal population, or what is advised by the World Health Organization, you will decrease by many times the risk of breast cancer, colon cancer, diabetes, heart disease, stroke. So there is a direct relation between the quantity of physical activity you are doing and the chance to reduce this chronic disease. So this is really the primary prevention of physical activity. Again, You can see on the next slide, this is another study that is going roughly in the same direction as the previous one, saying that regular physical activity at the correct intensity can reduce the risk of heart disease, stroke, diabetes, blood pressure, breast cancer, colon cancer, and so on. But what is also important is to show that physical activity is a very good medicine against depression, really. During quarantine, we know that it's a difficult time for everybody, and the risk to develop a depression or to develop a burnout is very important. And specifically for people with hemophilia, it's even more important to perform physical activity because as patient with hemophilia, you have a higher risk of the condition. Why? Because if you have target joint, if you have chronic arthropathy, for instance, you will walk less, you will be less active just because of your poor joint status. And we know also that older patients with hemophilia had in the past many immobilizations, so they have less muscle. Just imagine, for example, a very active man who is going to ski and then he has an accident. And because of this accident on the ligament of the knee, he's obliged to be at rest for 2 weeks. These 2 weeks of plaster of orthosis are sufficient to decrease by 10% the muscle mass of the quadriceps, so the bigger muscle of the leg. So just imagine a patient with hemophilia that had in the past to be immobilized many times in bed. Okay, so the next point that is very important is also to mention that patients with hemophilia are living longer and longer. So the life expectancy of patients with hemophilia is definitely better. And if you increase the age of people, you also increase the risk of developing sarcopenia. Sarcopenia is a normal concept. It's a normal evolution of losing muscle mass just due to age. It's happened in a non-hemophilia patient and in hemophilia patient. And do not forget as well that patients with hemophilia, some of them suffer from obesity, so they have a higher risk of type 2 diabetes, and they could have also other comorbidities such as HIV or hepatitis. So all these causes can induce a deconditioning in patients with hemophilia. That's why physical activity is so important. So now let's talk about physical activity during the COVID period. As you know, the progression of COVID-19 is largely dependent of the initial health status of an individual. And before to explain why, it's, I think, really important to re-explain what is the development of COVID-19. So it starts really with the incubation phase. In this incubation phase, the patient doesn't present with severe symptoms. But if the protective immune response is impaired or inadequate, the virus will proliferate and destroy affected cells, especially in the lungs. And during this second phase, the damaged cells induce a big inflammation of the lungs, which leads to the classic symptom of fever, of coughing. And in this regard, individuals with obesity and diabetes have an increased risk from COVID because the patient with obesity who are infected by COVID have a higher chance of invasive mechanical ventilation use. So that's why it's so important in patients with diabetes or with obesity to make physical activity. And so when the patient is developing fever or coughing, that's we call the second phase. The second phase is what we really say the calm before the storm. Because in a small group of patients with severe COVID-19 experience, they will develop what we call the cytokine storm syndrome. It's referred to the overproduction of immune and inflammatory cells 7 to 10 days following the onset of symptoms. And in healthy patients, these immune and inflammatory cells play a really important role in immunity. But dysregulated and amplified immune response are causes of severe lung damage and respiratory complication. So really the aim of the physical activity is to really reduce this phenomena of cytokine storm syndrome by just reducing the inflammation of patients. So the individuals with comorbidities who have a high level of fitness may mount a stronger host immune defense against COVID-19 and reduce, therefore, the susceptibility to risk an infection in the early stage of the disease.
Okay, we know what are the effects of physical activity, but you might question yourself, I have hemophilia, I have a past of joint bleedings, I have a lot of joint damage. Is it good in my condition to be physically active? And the answer is yes. It's extremely important, also for patients with chronic joint diseases. Now, this is also a difficulty because everyone is different, and you might have an ankle problem or you might have a knee problem. And so the starting level will depend of your condition, and that's the reason why it's not possible to give a general exercise program for everyone. But we hope that this presentation will give you some advice, some support, some guideline about how to be physically active, even if you suffer from joint pain. This is a really important knowledge that we have gathered the last 10 years, because we know that patients with chronic joint diseases need to be physically active. And this seems to be a slight contraindication, because as you know, the bleedings will lead to inflammation, of course, will lead to an increase in joint pain. You have a lot of consequences in the structures surrounding the joints, such as a reduced mobility, such as muscle weakness. This will alter your function, and in the end, you have a reduced quality of life because you're not able to walk stairs or to do your hobbies. But even in these cases, physical activity is extremely important. And we speak about physical activity as part of the pain management plan. And the reason why is because physical activity has, of course, local effects. Physical activity will increase the mobility of the joint, will increase the muscle condition, the strength, but also the stability of the joint. But physical activity will also have some central effects, and this is due because of the brain is active during physical activity, and also the central nervous system, so the nervous system that goes from the brain to your joints. And this descending system of the central nervous system is an important pain control mechanism. And by being physically active, you will activate this own pain control mechanism. And that's the reason why we know that patients with chronic joint pain should do physical activity, if possible, nearly every day. So if we look at the literature, what is known about patients with chronic joint pain? If we put all studies that have been done together, we know that 4 factors are important targets during the treatment. First of all, unsurprisingly, you have physical activity. Because of these central activating mechanisms, you will control the pain after being physically active for a moment, so it's not immediately. Secondly, it's also known that important targets of the treatment plan or the management plan are beliefs and emotions. Because if you are ruminating, if you we call it catastrophizing, pain catastrophizing, it's thinking that the worst will happening, that you will be worse and that you will not be possible to do whatever you want. If you have also symptoms of depression, Sebastian already mentioned it, that it's also in this current situation extremely prevalent. And finally, if you have the power, the belief that you can do something yourself, this is self-efficacy, this will be coupled with a better treatment outcome. So to summarize, physical activity, good beliefs, positive beliefs, and the belief that you can change something yourself, this self-efficacy are really, really important targets of the rehabilitation of patients with chronic joint pain. So physical activity is really part of a pain management plan. And the most important message is that you are not alone. You have healthcare providers in your environment that can help you, that can function as a coach. Because if you want to be better, you need to change your lifestyle. with the help of a physiotherapist, maybe also a psychologist if you have these symptoms of depression or the fact that you think that you cannot change something yourself, because active lifestyle is really important. And we will speak about the possibility of doing some progression in the physical activity, but this is all part of a management plan. So the main question is now, how can we be active during these COVID restrictions? Because this is not so easy. During a few weeks we were in quarantine. Now we have the possibility to go outside, but not with friends. It's complicated to go to fitness, maybe to your regular physiotherapist. But we know that it's extremely important to stay physically active even during these COVID restrictions. If we look at the guidelines established by the World Health Organization, we have some ideas about the amount of physical activity that it's needed to have these positive effects. They say that it's necessary to be active during 150 minutes a week if you are doing some activity of moderate intensity, for example, cycling or walking or swimming. If you prefer to do rigorous activity such as running, you have to be physically active during at least 75 minutes. But for patients with hemophilia, certainly in the beginning, we prefer to advise activities of moderate intensity. And that means that you have 2.5 hours per week that you should be physically active. Also importantly, the World Health Organization advised to include at least 2 days some strengthening exercise. Sébastien Lobet spoke about sarcopenia, or the muscle that is losing muscle mass, and so strengthening exercise will allow us to increase this muscle mass again. So strengthening exercise should be part of the rehabilitation program, also in patients with hemophilia.
So maintaining or increasing physical activity during the COVID-19 pandemic is really important. So if you have already a good level of physical activity or moderate level, you should try as much as possible to keep it. And if you are not used to do physical activity, maybe it's a good time to start this physical activity, because as we said previously, it has many advantages. Because it maintains physical capacity, the functionality, it really reduces the cardiovascular risk, and as we said, it really helps to prevent depression. And at the end, all together, it will definitely improve your quality of life. So what would be an ideal program to start? So as we said, it's really important to be active, of course, as much as possible. But if we take the example of doing, for example, 30 minutes per day, that could be a good idea. If you do it during the week from Monday to Friday, we will end up with 2.5 hours, which is perfect in the line of what recommend the World Health Organization. But what would be interesting is to divide the session between the aerobic training, so the endurance workout, with also some strengthening, as we said, and to also some exercise of stretching or improving in order to improve the range of motion. So the aerobic training, so the workout of endurance, you can start, for example, only by walking or running just 10 minutes, and then you try to increase progressively. Okay, you try to progressively by 2-3 minutes, 5 minutes every day. You could walk, you could swim, you could bike. For the strengthening exercise, you can also use lightweight that you can find at home. You can use devices in your home just to lift up. You can do also some very basic exercise to stand, to squat. You can use a bottle of water to do some flexion exercise for the biceps. And also, you could also finish the session with some range of motion exercise. You could stretch your legs, you could stretch your arms, because as a patient with hemophilia, it's really important to maintain a good range of motion. And stretching exercises are very good for cooling down exercise.
Okay, so what's your plan for the next weeks? try to change your mindset. Maybe you know that our current lifestyle predisposes to physical inactivity because we're sitting the whole day. So you can interrupt your sitting with a small break or 5 minutes and do some walking or some stretching exercise or some mobility exercise, such as suggested by Sébastien. But you can use every opportunity to be active. For example, take the stairs instead of the elevator. Go and walk outside, put your music on and do some dance movements. You can also include your children in the physical activity program because they are normally playing outside or inside, and you can do some exercise together. There are plenty of YouTube films that guide you through some exercise, but think about it. Put post-its everywhere so that you remind to be physically active through the day. So we would like to focus on 30 minutes, but as said, it would be nice if you can start with groups of 10 minutes, 5 minutes, 10 minutes, and add every day a couple of minutes so that you have a nice progression in the quantity of time you are physically active. And also remember that the variability, the type of exercise you are doing is important. So not only aerobic exercise, but also endurance, mobility exercise, maybe some stability, because stability is important in the prevention of falls, especially for older persons. So you have plenty of possibilities to be and to increase your physical activity.
And also, I would like to add, do what you enjoy. It's very important because, if, for example, you don't like to swim, it's useless to go to the swimming pool. You have to do something that you like, and you will see that you will have a lot of pleasure to perform it. And as Natalie said, okay, 30 minutes per day is the goal, but you can split it in session of 10 minutes, for example. And you have also to set challenging but also achievable goal. So, for example, you can use, for example, your smartphone. You can count the steps you are doing per day. For example, 10,000 steps per day, and then you try to increase. But every day you are checking that you are doing the sufficient movement. You can also, as Natalie said, to have a look on YouTube, on session. It's very important. Use the clock of your watch just to be sure that you are doing the exercise for 30 minutes. If you're working with the dog, try to do it, but with a good pace, so you can definitely increase the contraction of your cardiac muscles. So try to do some trick that you can really do from day to day to improve your physical activity. So Natalie and myself, we hope that you really enjoy this presentation. We try to convince you to be very active, and yes, we would like also to thank Sobi to giving us the opportunity to give you this video. And I will give the last word to my colleague Natalie.
Okay, we hope to have convinced you that physical activity is important. An important message is that pain might occur during the exercise, and it might be the result of a bleed. You know what to do. It might also be the result of the exercise. If you are not familiar with exercise, you might feel something in your muscles or in your joints, and that's not a reason to stop the exercise. So if you feel some pain in your joint, which is comparable to the pain you feel when you are doing some stairs or stuff like that, some loading of the joint, it's normal. If you feel some soreness in the muscles after the exercise the day after, it might also be because your muscles are not trained to do that exercise, and you have to be a little bit careful with the progression. But if this pain is something you are not familiar with, please contact your healthcare provider, because pain can be a warning signal of a bleed. It's not always a bleed, but it can be a bleed. It can be something we have to pay attention. So please do not forget to contact your healthcare provider should you have any concerns. We wish you a happy day and be active.